Hi everybody, this is Tony Tenweston, co-owner of Coastal ChiroMed, and just have an very exciting announcement to make. Now, some of you have already been here and met her, and just I know you all love her so far, but we just wanted to make it official on Facebook. So, welcome, Dr. Hawley.
Thank you. It's great to be here. Hi guys, I have met several of our patients already, and I'm very excited to be here serving the coastal area. I originally come from West Virginia, so it's quite a big environmental change for me, but so far we're loving it down here, minus the hurricane. Oh. But that's one thing about the stress in our life that kind of drives us to see chiropractors a lot of times. So we had a lot of people coming in after they were hanging shingles and hanging plywood up and getting ready for all that and moving their personal belongings in. So it was a really good week actually that we had with the patients coming in to help with their pain. So a lot of people know about chiropractic and that side of things where we do deal with pain, but we also help a lot of people with various conditions.
Well, before we get into that, why don't we just talk about you a little bit? Okay, you're from West Virginia.
I came from West Virginia.
What got you into chiropractic?
I actually started seeing a chiropractor myself when I was about 23 years old. I have twins. They're 16 now. So about 16 years ago, I was really suffering with a lot of pain. I was a school teacher, so I was on my feet all day long. I was teaching phys ed actually, so really on my feet all day long teaching elementary school kids, and here I was, pregnant with twins, and really was just in a lot of pain from that. So I had heard about chiropractic in the past, but it wasn't really something that people did very regularly where I'm from, especially back then. So I started seeing a chiropractor at that point, and it literally changed my life. It helped so much with the back pain that I was having and the discomfort from the pregnancy and ultimately from the delivery. And then just caring for twin infants, if you can imagine, I don't think I would have done as well as I did had I not been seeing a chiropractor full time at that point. So it changed my life so drastically that I decided that was something I wanted to look into. So I quit teaching. I went to chiropractic school myself. I graduated from Life University in Atlanta, Georgia, in 2011. And then I went back home to West Virginia. I've worked in offices in Georgia and West Virginia for the past several years. And then we were looking for other opportunities for our family. And there's a lot of different things with the laws and regulations and health freedom and choices that we were looking for our family. And South Carolina honors that and respects that patients have choices for their health and really honors alternative options and doesn't just necessarily stick people in a pain clinic and treat you like you don't have any options and that you're never going to get better. And we've experienced that with our own family members. Awesome. And chiropractic definitely gives us that opportunity for my life and that opportunity for our family's lives. So it really made a change, and that's why I pursue chiropractic care.
Oh, that's great. Now, some of your background begs the question now that you have specialty in looking after
yes,
young ladies
the International Chiropractic Pediatric Association does training and certifies chiropractors to treat pregnant women. They have special things going on with their spines, their gravity changes, the center of gravity changes in their bodies, their ligaments in their womb, and their uterus gets tight, and different things like that causes discomfort. But there's a lot of research out there that also can impact, the health of the baby and the delivery process. So if your pelvis is out of alignment, it puts strain on the uterus through the ligaments and all that stuff. So it's called the Webster's technique. I am certified with the ICPA to treat pregnant women with the Webster's technique, and we've been very successful with a lot of our pregnant mommies. And I guess I have a personal passion about that because, I have 4 kids now. I have my 16-year-old twin boys, I have my 12-year-old boy, and then I have a 9-year-old little girl. And I pretty much went through every birth things that you can experience through that process. And I was under constant chiropractic care with my 3rd and 4th child, and it made a huge difference in my life and in my delivery and everything that went on with that. So I definitely am passionate about getting pregnant moms under chiropractic care. It makes a huge difference in things, and it even helps, like I said, with the delivery process and going through labor, and it helps. There's research out there we can show you on the International Pediatric Association website that it helps what's called labor dystocia, which is slowed down the labor and the increased pain that women experience.
Really? Wow.
And to take that a little further, we also see children. So we definitely start seeing infants through that birth process, and so I'm very passionate about helping serve the community, and I'm just glad to be here, and really happy to meet everybody in the area.
Well, she's packed full of information. So what we hope to do is on a regular basis come up with some more specific things that chiropractic can help, and specifically how Dr. Holly can help with her specialty. So we're going to sign off. God bless y'all, and we're excited to have y'all come in. Bye.
Thanks.